Hello, everyone. Welcome. Thank you for joining us today. We are letting people into the waiting room, and we are excited to get started in a couple of minutes. So please be patient as people come into the waiting room. Hello, everyone. Welcome to today's webinar. We're going to get started in just a couple of minutes. We are letting people in from the waiting room, and we'll get started in a second.
Hello, everyone. We're letting people in. Give us a second to let all the participants in, and we'll get started in just a minute. Thanks for being here.
Hello, all. We're still waiting for people to come in from the waiting room, so just be patient for another minute here, and we'll get started in a second. Hi, all. We are giving it one more minute to let people in from the waiting room, so just be patient, and thanks. We'll get started in a second.
Hey, good morning. Thanks for joining. I guess it's good afternoon, actually. Thanks for joining us. We're about to get started here. This is our Whole Health Louisiana webinar, Lunch-n-Learn. I'm Anna Osland. I'm the Director of Research at the Blanco Center, and we're excited to welcome you to our 6th Lunch-n-Learn for Whole Health Louisiana. Whole Health Louisiana is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Louisiana initiative. And the Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with what Whole Health Louisiana is, it is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. The initiative has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, Whole Health Louisiana's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. All right, I'm going to turn it over to Quinn, who will be the moderator for today's session, and to introduce our speakers. All right, Quinn, take it away.
Thanks, Anna. Hi, everyone. I'm Quinn Nguyen, a research associate here at the Blanco Center and the coordinator for the Whole Health Louisiana project. I will be moderating this webinar and the webinars to come, along with my colleagues here at the Blanco Center. As part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of Whole Health Louisiana, and features presentations from industry professionals and subject matter experts. We have a webinar planned for one Thursday of each month through June, and each webinar will touch on various topics related to the goals and objectives of Whole Health Louisiana. Our planned webinars are listed on the Eventbrite page that you all used to register for today's event. In addition to the webinar series, Whole Health Louisiana is conducting in-person regional trauma-informed care training sessions across the state. Our last and final one will be in Monroe on the 25th of this month. If you are in that area or if you're interested in attending our in-person training, check the links out in the chat that my colleague will drop. If you have any questions about what the in-person training entails, feel free to ask any questions or contact us. I'm going to go ahead and introduce our speaker for today, Kristen Rome. She is the executive director at the Louisiana Center for Children's Rights. She holds a BA in political science from the Spelman College in Atlanta, Georgia, an English law certificate from the London School of Economics and Political Science in London, England, and a Juris Doctor from Loyola University, New Orleans College of Law. She completed an externship with the Orleans Public Defender's Office and participated in the Stuart H. Smith Law Clinic and Center for Social Justice as a student practitioner. Kristen opened a criminal defense practice with her father upon admission to the Louisiana bar, with a commitment to providing accessible, client-centered legal representation. Kristen defended both adults and juveniles in Louisiana. Throughout her private practice, Kristen maintained a focus on ending juvenile life without parole, successfully advocating for parole eligibility in several cases. I'm going to go ahead and hand it over to Kristen, our presenter, to go ahead and give her presentation. Thank you, Kristen. Kristen, we can't hear you. I don't know if anyone else can't, but can't hear you on your side.
Let's try it out. All right.
Oh, I can hear you now. Can you?
Hear me now?
Yeah, it's a little
All right.
low.
Let's see here. Is that any better? Yeah. Can you guys hear me? How's that? Is that working, y'all?
Yes, that works so much
Okay.
better. Thank you.
Okay. My Zoom has been doing strange things lately where it's always a case. But if anyone is having trouble hearing me, let me know. I'll try to speak as loudly as I can. So, thanks y'all for having us. I am going to show you all go through a presentation where I talk to you a little bit about the work that LCCR does as a whole, but also what we are primarily focused on right now, and what I think will be important to all of you here. I'm gonna share my screen. I had this as a PowerPoint, but I just looked at the formatting and it's a little off. So I'm just gonna use a PDF so that I can make sure you guys can see everything. All right, I'm gonna try to share here. Hey, you guys, let me know. You can see my screen. I think that should be good. Okay. All right, so we'll go ahead and start it. So again, I'm Kristen Rome. I am Executive Director. Maybe adjust to zoom in on the slides. Let's see. Are you guys able to see this? Is that okay? Yes. All right, great. So again, perfect. Thank you. I'm Kristen Rome. I'm Executive Director of Louisiana Center for Children's Rights. And I'll tell you a little bit about the work we do. So who we are. We are, the long and the short is, we are a nonprofit law office that supports young people who are arrested and incarcerated throughout our state. We do this in two different ways. We do this one as the Juvenile Public Defender's Office in New Orleans. That means we represent about 90% of the young people arrested in New Orleans. So we represent them in court, and we do that through holistic representation, which means we not only defend them, but we also provide them with social workers and youth advocates who help us get to the core of what's happening in a young person's life, because we understand that when a young person commits a harm, it's a symptom of a greater need in that young person's life. So we do this direct rep work with young people, but also we do statewide policy and advocacy work for arrested and incarcerated young people. We use what we learn from our direct rep work to help us better understand policy needs for young people and address those needs directly. So we advocate for young people to have better conditions of confinement. We advocate for young people who are arrested and incarcerated to have access to mental health resources, to have access to education. So again, thinking about the whole young person. So we fight to keep children out of the justice system, essentially so they can thrive at home in their communities. We know that to create community safety, young people have to be able to thrive in their homes and in their communities. And we envision in Louisiana where every child, irrespective of their race, their class, what they're treated like children and supported in becoming healthy adults. So what we do, again, we're the Juvenile Public Defender's Office, and no matter what it takes, we understand that while young people need support inside the courtroom, young people also need support outside of the courtroom. So our social workers, in collaboration with our defense teams, they figure out where are the gaps in young people's lives. And the young people that we serve really and truly are at the intersections of so many systems that have failed them or just cannot meet their needs. And so our social workers are able to take that high level view and see, like, where does this kid need more support? Do they need housing support? Do they need mental health support? Do they need career support? Do they need education support? And then we write plans. We do biopsychosocial histories. And in collaboration with our social workers, our youth advocates put actual feet to these plans. So if we recognize that a young person needs behavioral talk therapy once a week, this is what they need with their families to be able to thrive. Our youth advocate might be responsible for literally picking that kid up from home every week and bringing them to their therapy sessions to make sure that they're getting what they need, again, to not only get out of the system, but to leave the system behind for good. So they're not being rearrested, trying to interrupt that cycle. And then again, advocacy. We tackle systemic issues that trap poor youth and Black youth in the justice system. What we've identified and what we've worked on so far is youth in the juvenile system. This has been a huge issue, and we'll talk more about this and what we're working on right now. But trying young people as adults and putting young people in the adult system as opposed to the juvenile system has been a huge issue in our state. And this year we became, or 2024, last year, we became the first state in the country to roll back raise the age legislation. So the overwhelming majority of the states recognize that for the purposes of arresting a child, that the age of adulthood doesn't start until 18. In Louisiana, we decided, though we passed that law in 2017, we rolled it back in 2024. So now, for the purposes of criminal prosecution, if you're 17 years old and you're arrested for anything, Louisiana recognizes you as an adult. Even though you can't vote, even though you can't get married, even though you can't sign a contract, even though you can't buy cigarettes, if you are arrested, you are an adult. So that's one thing that we've tackled. And then extreme sentences, conditions of confinement, all of these things that I referenced earlier that we advocate for around young people. So a quick recap on the as a part of our advocacy, So we are there in Baton Rouge. Sorry, I'm seeing that maybe my internet is unstable. Sorry, y'all. Um, hopefully you can see the slide. I'm happy to share these slides as well. But I'll go through this quickly. We had some really, really big shifts during the 2024 legislative session that have impacted young people in a very difficult way. So one, Governor Jeff Landry did a lot of quote unquote tough on crime stuff. Young people were a specific target of this. And like I said, raise the age was rolled back. And these policies are worse for children. They aren't making it better. The results of tough on crime policies that we've seen forever just don't work. If we could incarcerate ourselves out of this issue, we would be done with it by now. Louisiana has been the incarceration capital of the world for quite some time. Separate plug here, if folks are able to visit the Historic New Orleans Collections exhibit on incarceration in Louisiana, it is incredibly eye-opening and something I suggest everyone check out. But the tough on crime policies, in a nutshell, just are not working for us. We cannot incarcerate ourselves out of what is happening in our world and in our state, in our country. And you all know that this is Whole Health Louisiana. And so understanding that to be healthy, we have to be looking at the whole person. Biggest takeaway is raise the age was repealed. Again, we became the first state in the country, joining only 4 other states, recognizing young people who are 17 years old as adults for the purposes of criminal prosecution. So I want to talk a little bit about Act 3, which is now Amendment 3. So thank you for dropping that link, Liz, to HNOC's exhibit. It is incredibly powerful. Please go see it if you haven't. And also, HNOC is free and it's a beautiful museum. I just got to visit it for the first time recently. So Amendment 3. So you guys may remember back in October, November, there was a special session called on tax. So all of us paying attention to that session, we all thought that the only thing that was going to be addressed in that session by our lawmakers were the things related to the tax code and how we do taxes in Louisiana. Well, the first 2 bills, Senate Bill 1 and Senate Bill 2 that were passed were actually bills that had nothing to do with tax. Senate Bill 2 is what now has become Amendment 3, or Act 3. So Act 3, as it was passed from our legislature, is a proposed constitutional amendment that seeks to remove the guarantee that children under 17 will remain in juvenile court. So essentially, our Constitution creates a floor of rights. All constitutions do. The Constitution is the floor, and it makes sure that you are not treated any less than this standard. Right now, there's a protection in our Constitution for young people. And it says that if a young person is under the age of 17, they can be tried as an adult only for an enumerated list of crimes. That's written in our Constitution. I want to be clear that that enumerated list includes the most heinous and dangerous violent crimes. So right now, for things like carjacking and murder and armed robbery and rape and kidnapping, all of these are crimes that if you are as young as 14 years old in the state of Louisiana, you can be tried as an adult for. But again, the Constitution provides the protection that only these crimes that are enumerated can be transferred to adult court. What Amendment or Act 3 seeks to do is remove that protection, remove that floor, so that now the legislature can decide that any felony can be transferable to adult court. So that means if you're 14, 15, 16 years old and you commit any felony, you can be tried as an adult. So to give some context for that, well, before I get there, I want to just say that we know that transferring kids to adult court is a failure. It doesn't make us safer. Young people are more likely to be harmed in adult court. So there are so many reasons to oppose this. So a little bit about the harms of the adult criminal legal system. Youth held in pretrial and adult facilities, they're not structured to move with the same speed and special implications of youth. So when young people are tried as adults, the timeline on when they are tried, when their trials happen, when they are transferred from certain facilities, the timelines are much longer in adult court. So what you end up seeing is a greater disruption in a child's life. So for example, in the youth system, if a young person is tried with a crime, it moves pretty quickly. There are specific timelines that make it such that if a child's life is disrupted by arrest and incarceration, we move really quickly to figure that out so we can get them back home in their communities and in schools as soon as possible so that they can continue with their lives and continue to thrive. The adult system provides a much longer interruption. On average, people detained in Louisiana adult jails who can't afford bail, they sit in jail for 5.5 months before their case is resolved. And those are for really low-level crimes. For the higher-level crimes, folks are sitting in jail sometimes for 2 to 3 years waiting for trials, particularly when we think about the backlog that we are managing post-COVID, post-pandemic. As a teenager, this means lots of missed school. That means being disrupted from your community. And all of these are things that increase recidivism and increase the likelihood that a young person will reoffend because now they are disconnected from all things that provide them with stability. The other thing about incarcerating young people in adult jails is there's an increased risk of suicide and a much higher chance of a young person being sexually or physically assaulted. And I want to put a pin here and say that this does not at all mean that adults in adult prisons are predators. It means that young people are more vulnerable. And so oftentimes we're seeing them being taken advantage of even by guards in the system. So the important thing here to note is that young people are just vulnerable and need additional protections. It also means more kids without educational opportunities. Here in Orleans Parish, there is a school, the Travis Hill School, in both our youth detention and also the Orleans Justice Center, our adult jail. But across Louisiana, adult jails do not have schools in them. And jails are required to provide education to people under 18 years old. And if there are special needs, up to 21 years old. Our adult jails are not set up to be able to provide schools in that way. So what ends up happening is a young person may be getting a worksheet, which is not at all on level. Oftentimes there are no placement tests. And so essentially they become disconnected from school as they sit in adult jail. All of these things lead to increased recidivism and increased reoffending compared to young people who sit in youth facilities. So to explain where this goes, on March 29th, there will be a statewide election to vote on 5 constitutional amendments, one of which is Amendment 3 that we talked about, the one that will allow young people to be transferred to adult courts for any felonies. On March 29th, everyone needs to go out and vote against this amendment if they believe in a young person's capacity to change, if they believe that young people should be treated differently, and that we shouldn't be transferring young people to adult courts. So there are a few things that we think that you can do to make sure that this doesn't happen. One, talk to your family, talk to your friends about the March 29th ballot and why you are voting, whichever way you decide to vote. Reshare information through newsletters and social media. I'll have another slide where you'll see our social media, but it's LA Kids, KIDS, Rights, RIGHTS.org is our website, and all of our social media handles are at LA Kids Rights. Please follow us on social media so that you can learn more about Amendment 3 and what we're doing to stop it and how you can be involved. Donate to our efforts. This election is going to require resources, but also we're a nonprofit law office. We are making sure that the most vulnerable children in our community have access to social workers, that they have access to responsible adults and mentors like our youth advocates or our reentry specialists, that young people are getting what they deserve in schools, that they're getting what they have a right to in schools, and that they're getting the housing that they need, the mental health resources that they need. So please support our work in knowing that the work that we are doing is to create community safety. It is about recognizing the whole being of a young person in our efforts to create community safety. And then finally, as we talk about No on 3, please visit the website. It's noon3la.org. You can learn more specifically about No on 3 there at that website and things that are happening. There are resources there that you can feel free to share with others in your community. But the reality is we need folks to know what's happening. We need folks to know about this election, and we need folks to show up. We need folks to understand the changes to the Constitution, and understand what this could mean for our state if we allow these constitutional changes to happen. Finally, stay in the know. These are all the ways to connect with us. So again, on Twitter, we're at LA Kids Rights, Instagram, LA Kids Rights, Blue Sky, which is new, lakidsrights.bsky.social. We're on Facebook as Louisiana Center for Children's Rights. Our website is lakidsrights.org. And if anyone has any questions or follow-up, please send an email to our policy director, Tiye Davis, at tdavis@lakidsrights.org. Thanks, y'all. We appreciate it so much. And I'll open up to questions now. Just like any discussion, question, thoughts.
I'll give it a couple of minutes for questions to come fielding in the Q&A box. Just a reminder, if you have any questions or even comments, you can drop it in the Q&A box down below. I'll give it a couple seconds for people to kind of think and, ruminate on all of the stuff that we just learned out. Thank you, Kristen. That was a lot. I was just shocked at the information that you provided, to say the least.
Yeah, so let me say, I said a whole lot. Please feel free to ask anything, even if it's like, hey, you didn't mention this in the presentation, but I'm just curious about this thing as it relates to young people. I do see an answer in the Q&A when the amendment vote day is and what it's for. So please visit noon3la.org to get the full details, more than I can share in this call considering our time constraints, about this particular amendment. But the election is March 29th. There will actually be 5 amendments on that ballot, 5 amendments that are amendments to our Constitution. I can tell you that we are definitely pushing a no on 3, because no on 3 is what directly impacts young people. But I encourage everyone to understand all 5 of the amendments and be clear about what your position is on all 5 of the amendments. Anytime a constitution is being changed, is very serious. It is nothing for us to rush through, and it is something that us as citizens need to understand and need to be a part of. So I encourage you to just understand what all 5 amendments are about, and to visit noon3la.org to get a better understanding of Amendment 3.
Thank you, Kristen. I just want to note that the link to the website is dropped in the chat, if you want to go check it out. We also have another question for you, Kristen. This one says, this work seems very interdisciplinary to accomplish a lot on advocacy efforts. How do you collaborate with other professionals to do this work? Advocacy, use of trauma-informed care, or anything else?
That's a very good question. Thank you for asking it. And you're absolutely right. It is interdisciplinary because, again, the young people who we serve are at the intersections of so many systems, and they are so deeply in need. So the way that we collaborate with others is, one, we have, through our advocacy efforts, we have community partners. We sit on the steering committee of a coalition called the Youth Justice Advocates that is here. We are building into a statewide coalition, but right now have a pretty strong roots in New Orleans. We meet monthly. Our monthly meeting is actually today at, I'm gonna look it up. I think it's at St. Roch Community Church. Pretty sure of that. But I want to invite folks or tell folks. Yes, it's at St. Roch Community Church today from 6:30 to 8. We meet monthly and we come together. We're a coalition of about 30 organizations right now. Together we form the Platform for Youth Justice, which you can Google the Platform for Youth Justice and you can find it. But we get together, we are people and organizations, individuals and organizations that work with and serve young people. And we get together every month to talk about the work that we're doing and to be in partnership so that when LCCR has a client that is in need, we know where our partners are and where to refer them, but also that our partners know when they are working with a young person that has been incarcerated and is being prosecuted, they know who's working on that and they know that they can call us and talk to us. So we have a number of community partners that we solidify through the Youth Justice Advocates. And then through our direct representation work, our social workers and our client services division have built relationships with various community partners who we oftentimes refer young people to. So if there are things that you can provide to young people, in particular, arrested or incarcerated young people, please feel free to reach out to us. Again, email our policy director, Tiye Davis, and we'll connect you with our social workers. If you are like, hey, I'm a person that if a young person needs a job, they can come to me, or my organization provides therapy to young people. You can refer young people who need therapy to me. Please let us know. We'll make sure you're a part of our resource list that our social workers use to refer our clients to. Thank you.
Thank you, Kristen. We also opened the chat for everyone. If you have any comments or anything that you'd like to say to Kristen or anything else, you can put it in the chat box. But questions still go in the Q&A box so we can see them as they come. Kristen, if you want, since we opened up the chat, if you want to drop the information of that coalition meeting for everyone to have, that I think that would be really helpful. I'll give you a couple seconds to do that before I follow up with the next question that we have here.
If you want to join the Youth Justice Advocates, you literally just pull up to the meeting and you say, I am here to join the Youth Justice Advocates. If you want to be placed on the Youth Justice Advocates email list, I'm going to drop into the chat the email address of the Youth Justice Advocates, and you can email this email address and let them know you are interested in joining the list and being included on the invites, and you'll get, sorry, I need to change where I'm, oh, Liz, you'll read my feed. All right. Okay, there's an email address. If you're interested in joining the Youth Justice Advocates, you can either just come to the meeting this evening at 6:30 at St. Roch Community Church, or you can email the email address that's just been dropped, that will be dropped in the chat, and let folks know at that email address that you don't need to let them know you met me or you attended this. You can just say, hi, I want to be a part of the Youth Justice Advocates. Can you please make sure I'm included on future invites? We do not have chapters just yet in other parts of the state, but we would love for folks to join, especially if you are in other parts of the state. Please email us and let us know, like, hey, I'm in Lake Charles, I am in Bossier City, wherever you are, and say, I want to figure out how to bring this to my community. And we are so excited to do that.
Awesome. Thank you, Kristen. I'm going to go ahead and start fielding the other questions. We have some more come in. Someone asked, given the violence that happens in prisons, how would underage youth be housed in adult prisons to ensure their safety if this passes?
Yeah, so we don't know, right? we know what is required. So federal law, there's an act called the Prison Rape Elimination Act, PREA. PREA requires that young people, under federal law, this is anyone under 18 actually, because under federal law, adulthood is 18. Anyone under 18 years old who is held in an adult prison must be sight and sound separated from incarcerated adults. So what this means in practice is young people, anyone under 18, has to be on a completely separate tier from incarcerated adults. This becomes a huge problem, especially in rural parishes, because in rural parishes, these are much smaller jails run by much smaller sheriff's offices. So while the Orleans Parish Jail has the capacity, barely, side note, but in some ways has the capacity to create a separate tier that is just for young people, most adult jails in our states do not have that privilege and capacity. So what ends up happening is young people are oftentimes held in solitary confinement completely just for their quote unquote safety. The implications of holding a young person in solitary confinement, I don't think I need to explain to this group of people how it can impact a developing young person when they are held without social interaction. I don't think I have to explain how scary that can be for a young person and what we see, the increases in suicidal ideations, the increases in depression, and just really their inability to cope, socialize, all of these things. So oftentimes the way they are protected is by being held in solitary confinement because federal law does require them to be sight and sound separated.
Thank you for your answer. I want to address another question. I want to go back to the Youth Justice Advocates event tonight that we were talking about. Someone asked if there's an official flyer or invite for tonight's event, if you have that.
There's not an official flyer invite. So once you get on the listserv for the email, you'll get email updates. There's not an official flyer because we're a coalition that just meets every month, and we're on a listserv together. So there's not an official invite. Again, you are just welcome to come, but I understand it's last minute, so please email the email address and we'll make sure that you're on the invite list for the rest of the meetings. And also just to note, those meetings, we alternate each month between daytime meetings and evening meetings, and we provide Zoom links. The reason why we alternate between evening and afternoon meetings is because this is an intergenerational coalition. We recognize that young people have to be at the center of the work that we do, and young people have to be able to tell us what they need and what they want. So young people are an important part of this coalition, and we know that the daytime meetings, they're at school. So we have these evening meetings to make sure that they're able to attend.
Awesome. Thank you for that clarification. We have another question. Someone asked, can you recommend a source or website where we can find statistics on the impacts of incarceration have on youth?
Yeah, so no, I'm doing it as I talk. So the Sentencing Project is one to look into. If you Google the Sentencing Project, Children's Center for Law and Policy is another one. What I'll do is, so that I'm not just rattling things off, in addition to those, I will make sure that Liz gets a list of some places you all can look, and that'll be a part of a follow-up email that all the attendees can get. But yeah, there are plenty of websites, but I would start with the Sentencing Project. Children's Center for Law and Policy is also a good one to start with.
Thank you. I'll also vouch for the Sentencing Project. They have lots of awesome resources and information. I've used a lot of their statistics and their sources before in projects when I was in school. So thank you. And we have another question. When young people 17 years old or younger are put in adult jails, are there any protections that an advocate could ask for that may protect them from assault?
I think it is if I'm being honest, I think there's no real way to prevent it, right? Like we cannot control what is happening inside of jails. Oftentimes, the jailers themselves cannot prevent or control what's happening inside of jails. But I think as advocates, what we can do is push for laws to be followed. So recognizing that as we are putting young people in jails, adult jails and prisons, they must be sight and sound separated. We should be advocating for that, but we should be advocating for it to be done in a way that protects their well-being, not just stuffs them in solitary confinement. That is not protecting them. But I think another way that we should be advocating and pushing to protect young people from assault is recognizing that young people just do not belong in adult jails and prisons. And that is something we should be pushing against. It is not, adult jails and prisons are not built for young people. And even if we decide, if as a society, that we want to try young people as adults, whatever that means, to try someone as an adult, like I can't be tried as a 54-year-old white man if I commit a crime, because I'm not a 54-year-old white man. So this idea that we can try a kid as an adult and they are not adult in and of itself is just a complete failure and fallacy. But even if we agree that some crimes require more serious treatment, we can also agree that while we hold and house that young person, that we make sure that they are protected and that they are in a space that is safe for them. And what we know is that by and large is a juvenile jail. So I think it is just continuing to push that children be treated differently in the system. And I think another big thing as advocates that we have to start talking about is that we deserve options and that there's not one way or another way, but that everything that exists right now in our legal system is a creation. We created it. We agreed to it. We made it up. We can make up something new. If what is happening isn't working, we get to innovate. We get to try something different. And in many parts of our society, in the tech industry, for example, there's constant innovation. Things are constantly growing and changing. We're trying new things. We're trying to be on the edge of what's new and what works. And in our legal system, we have not innovated in centuries. It is the same. The idea of incarceration has remained the same. And so I think as advocates, part of our job is to not know immediately what is the change or what is the one solution. There's not one change. There's not one solution. It is to recognize that we need to innovate. We need to try new things. I hope that's helpful.
Thank you for your answer. We have another question that's in the chat box. As a lawyer, how do initiatives such as Whole Health Louisiana inform your work and/or provide opportunities for collaboration? Many of our webinar attendees are in fields such as social work, counseling, or healthcare or medical workers.
This is such a good question. So, prior to coming to LCCR, I was in private practice and I was doing youth work. I was doing juvenile life without parole work. And it became my entry into understanding clients, putting language to understanding my clients as a whole person, recognizing that when anyone, young person or adult, commits a harm, there's a context in which that harm was created. And when we look at the context, we start to think about things like their physical health, their mental health, their safety and housing, and how all of these contextually impact the act or the harm. And juvenile life without parole work really became my entry into that. And then when I came to LCCR, I was introduced to a public defender's office that supported that in a real way. There were social workers working here. And people who were clear about, like, we cannot talk about a young person, we cannot represent a young person in court unless we understand all these other things about the young person. So as a lawyer, initiatives like Whole Health Louisiana are vital to the work that I do, because as a lawyer, I recognize that when I am working to serve a young person, I am but one piece of the puzzle to help this young person get back on track and to help get us towards community safety. If I do my job well and I get a young person back in community and outside of the harms of the legal system, unless I've connected this young person with someone who can have these other parts of the puzzle, I'm not really serving the young person. So it's really integral. And I think that this is part of the innovation that we are starting to see and create in the legal system, recognizing crime as a public health crisis, recognizing that crime is not about one thing. It's about so many things. Harm in community is about so many things. And part of our innovation together, initiatives like Whole Health Louisiana are part of that innovation, part of saying like, hey, incarceration is not this one thing. The legal system is not this one thing. This is not working. Let's call on social workers. Let's call on health there and figure harm in our community.
Thank you, Kristen. I love that answer so much. Thank you so much for touching on the different aspects of this work. You made a lot of great points about how we are all part of the different pieces and, how we can help people and serve populations. So thank you so much for your answer. I really loved it and how you addressed that. We have another question that asks, how do you practice self-compassion and self-care in this work? What strategies do you use to address secondary traumatic stress in yourself and your colleagues?
Yeah. So this is such an important question as we do this work. And it is another one of these things that, we are trying many things and we are trying to innovate and get to a place where we understand how do we create self-compassion? How do we create self-care? I can tell you some of the personal strategies that I use and then some that we employ at LCCR. So I attend therapy. I recognize that the work that I do is heavy. It impacts me. It impacts how I see the world. And in order for me to be able to sustain myself here, I need to be able to process some of the things that I am experiencing through doing this work. So therapy has been a part of my self-care practice. Doing something creative is a huge part of my self-care practice. The work that I do is abolitionist work. I am here to destroy systems. And as I destroy things and as I see destruction around me, I need to be creative so that I can know that there is balance. There are two sides to everything. So for me personally, that looks like doing ceramics. I do ceramics every week. I've been doing ceramics for the past year. I'm a baby ceramicist. One day I will be a world-class potter, but I'm not there yet. So I do that. And then most recently I've started doing improv. Improv acting. I'm in my first improv class. And it's a way for me to give myself time to learn more about having space and time to think, to learn more about how to listen. And another thing that improv is helping me with is learning how to be in community and work together as a team. So those are the things that I'm doing to care for myself and to have compassion for myself. As an organization, we do a couple of things. We recently have implemented unlimited leave here at our office. Now it requires very specific planning so that everyone gets what they need and so that our clients have what they need. But we recognize that it's important that people take time off and that they take off the time that they need to be able to do this work. And we have mental health days. So these are days when we just wake up and we are like, I'm not here. I cannot do it. I need to care for myself today. So at LCCR, we use those. And then we do an annual mental health stipend for our staff. So every year in January, our staff gets a specific stipend that we expect them to use towards mental health. That can be to pay for therapy, that can be to buy a treadmill, that can be to pay for yoga classes, but whatever works for them. So I hope that answers your question, but it is tough and it is part of what we're trying to figure out. And being in community, that's the final thing that I'll say about self-compassion and self-care, recognizing that this work requires deep community. It requires us to have friends and colleagues and loved ones and know that as we are doing this work, we're not alone, we're together in it. I see one more question if you want me to answer it.
Yeah, go ahead.
Okay, it says, again, thinking about your specific role in the legal system, what strategies do you use to create a safe and supportive environment for people with trauma experiences? Another very good question. And I want to acknowledge that this is specifically important for us because one thing that we focused on in the past year at LCCR and will continue to focus on is hiring directly impacted people to do our work. No one better to tell us how to do the work than people who have had experience with the so-called justice system. And so as we recognize that we are hiring people who are directly impacted, we recognize that we are hiring people who will be more triggered, that people who have had traumatic experiences. And so the way we do that, again, outside of the ones that I've mentioned, is really making sure that our social workers are guiding us in this and helping us understand how to be trauma informed, helping us understand not only how to signal to one another and talk to one another about traumatic experiences, but also how to approach our clients who themselves have been through traumatic experiences. I'll tell you one beautiful thing, and then I'll stop, but I'll tell you one beautiful thing that we do at our office to address a specific reoccurring trauma. When I started here, one of the most difficult things to experience was the loss of a client. Having a client be killed through gun violence was just happening constantly, and seeing how it impacted the teams that had been working with this young person. So one thing that we did is we implemented a policy. How do we deal with this? How do we announce this to staff in a way that is just not being blurted out in ways when people can't address it? So we implemented a policy to figure out, how do we share with staff when when we've lost a client to gun violence? And as a part of that policy, one thing that our staff came up with is we've created a small altar and a candle. And so if you come into our office space and the candle is lit, that signals to anyone in the office that someone in this office has experienced the loss of a client. And so it allows us to move differently through the office and to know that whether we know who the client is or who the staff member was, we now can hold space in knowing that someone in this office is dealing with a loss, someone we care about and love and have worked with has been lost. And so it changes the way we move through the office, the way we speak to one another, and the way we just approach the day. So again, trying to be informed and trying to be trauma informed and recognize that we are being triggered constantly in this work that we do. Thank you for that question.
And thank you for your answer. I love that idea of the candle. I think that's really beautiful. And it is rooted in trauma-informed care and making sure people, are feeling safe in their working environment. So I love that a lot. Does anyone else have any questions for Kristen? Again, feel free to drop it in the chat box or come in the Q&A box. You can also come off of mute if you'd like. We still have like 9 minutes remaining. So we still have time to ask Kristen some more questions. Or, if you have anything else that you would like to say there.
I can just also add, like, this part of the conversation is so important to me. I appreciate the questions around how we are caring for ourselves and providing trauma-informed care to our staff. This has been post-pandemic has been such a huge, or I guess initiated by the pandemic, I should say, that the health of our staff has been such a huge part of our work. Another valuable thing that we've implemented is our staff is enrolled in an employee assistance program now. And amongst many different values come through employee assistance program, but one that I see staff using quite often is it provides access to free therapy, up to 6 free therapy sessions per issue. So if a staff member is dealing with grief, for example, they can get 6 free therapy sessions with a therapist that they're choosing, that we're referred to. There are some that are here in New Orleans in person, and there are some that are spread throughout Louisiana that you can do virtually. And then through those 6 sessions, if another issue comes up, you can get another 6 sessions for another issue. So oftentimes reminding our staff to talk to someone, use up that therapy to get what you need.
Yes, thank you. And I advocate therapy for everybody. Especially in Louisiana, if you've experienced hurricanes and things like that, any natural disasters, that's already a traumatic experience. And everyone will experience at least one form of traumatic exposure throughout their life, whether it caused severe distress or not. It's still something that you hold within yourself, and something that might want to talk through with somebody. So I advocate for therapy. It looks like we don't have any other additional questions or comments. And we can go ahead and wrap it up early. For everybody, I do want to remind everyone of the post survey. If you're getting CEU credits, please remember to complete that survey, and also remember to sign up on the form for your credits. All that information is in the chat if you need that reminder. And again, I want to thank everyone for attending. Thank you, Kristen, for your time and for your presentation. I loved it so much. I hope everyone else learned a lot and gained a lot of insight from it for today. And thank you, Lisa, as well, our interpreter, for interpreting today's session again. Our March Lunch and Learn will be on the 20th, presented by Robert Hines and Kenyatta Royal. So more information about that is on our Eventbrite page. And again, we'll send up a follow-up email for everyone with all of the information that Kristen has shared with us, in case you would like to use that for future references. So again, thank you, everyone. We're going to go ahead and wrap it up today. Thank you for attending. You guys have a great day.
Have a good day.